Hello and welcome. I am Katrina Pratt Roebuck, and I am the founder and CEO of Uplifme. And Uplifme is a resource hub that provides information on social service events happening across the country and also highlights the fantastic work that's done by organizations here in Philadelphia. So today I have with me Ayana Bradshaw, who is the Executive Director for Health Promotion Council of Southeastern Pennsylvania. Hi, Ayana. Thank you so much for being here.
Hi, Katrina. Thank you so much for having me. I'm so excited about this interview.
Great. So let's delve right in. Can you talk a little bit about Health Promotion Council and the work that you do?
Yes, so I'm very proud of the work that we do at the Health Promotion Council. We have the mission of promoting health and preventing and managing chronic diseases, but we also address health-related social needs. And so we have been around since 1981. For a really long time, where we reach more than 40,000 people across Pennsylvania, as well as parts of Delaware each year. And we are a subsidiary of Public Health Management Corporation. And so Public Health Management Corporation has a network of subsidiary organizations, but we are a separate 501c3 nonprofit organization. Our focus is really on health equity and ensuring that we are providing culturally responsive services. And we really try to fulfill our mission in three ways. So we conduct health education and direct services. That means that we are employing health navigators, community health workers, trained health educators, really to work directly in communities, in their own communities, and provide that targeted health education and navigation support. We also do a ton of work in capacity building, really providing that training. So it could be in-person, virtual training, technical assistance. We offer curriculum development and other services that really strengthens another organization's ability to address public health issues. And lastly, we do a lot of work around policy and systems change in terms of developing and implementing those policies that would enable healthier behaviors. So we have 5 key departments within Health Promotion Council. One is our Nutrition and Active Living department. We have a supplemental nutrition assistance program education grant, and we go into health centers, into community-based organizations and schools to really provide those individuals with healthy food choices, learning how to make healthy decisions on healthy food choices and physical activity. But we also do work in homeless shelters as well for our Nutrition and Active Living department. We have a tobacco prevention and control department. And this is a department that works in Southeastern Pennsylvania, really building that regional infrastructure for implementing tobacco control and prevention intervention. So that can mean tobacco dependence treatment, providing merchant education, compliance checks, making sure that merchants are not selling tobacco to youth, as well as educating youth on tobacco prevention. We also have a family services department. That's a department that really supports the maternal, child, and family health and well-being. And so that can mean things like home visiting, going into homes, working particularly with children with special healthcare needs. But we also have parenting programs. So we have a program called Focus on Fathers, where we're providing case management and navigation support to fathers in Philadelphia. We offer navigation support for family planning, for cancer, breast and cervical cancer. So family services really does a very broad range of services to support the family. We also have our training and capacity building department. That's a department that, as I mentioned, does a lot of support in supporting other organizations in their efforts to address chronic diseases, particularly a lot of work around diabetes prevention and management. And then lastly, we have our Advocacy Institute, and that is a youth engagement, youth empowerment program, really giving youth the skills and the tools that they need to be advocates in their community around public health issues. Wow, so that is who we are in a nutshell. It's a lot, but we are really excited about the work that we do in the communities that we serve. We're in 32 counties of Pennsylvania, as well as parts of Delaware.
Wow, I didn't realize that your organization served folks outside of Philadelphia. And I have heard of Focus on Fathers. I didn't realize that that was part of Health Promotion Council. So can you talk a little bit more about what it looks like, the work on the ground? So you mentioned working in shelters, you mentioned tobacco prevention. What type of, what does it look like, the work that you provide? What does it look like on the ground?
Yeah, it really varies depending on the department. And
Okay.
so, for instance, in our nutrition and active living department, we have our nutrition educators who are going out into the schools, working directly with the students, teaching
Okay.
them about nutrition education. Some of our nutrition educators are going into markets, into community centers, into primary care facilities where we are teaching individuals of how to make healthier food choices. We do food demonstrations, hands-on
Okay.
food demonstrations within that department. Within our family services department, we have individuals, particularly those some with lived experiences. So we hire community health workers who are then going into homes and helping those families to connect to other resources, to connect to services, to get their medical appointments, whatever support they need, and really identify where are their other needs. Is food insecurity a need? And then we will connect them with those services to ensure that they are getting support in that way. So each department is really based on the needs of the community that they are serving, and that's how we go into those communities to support them.
Okay, great. So can you talk a little bit about how it sounds like there is an opportunity for organizations to reach out to you all to get support and resources as well as individuals? Can you talk about how someone can reach out to Health Promotion Council to get services in their facility, if it's a shelter or school, and then how individuals could get services from, say, your community health workers?
Yeah, so everything that we do is on our website, which is hpcpa.org. Again, hpcpa.org. And within that website, there's a tab for services. And
Okay.
we have detailed information about how to get connected to each program. We
Okay.
also do outreach directly. So, for instance, with our training and capacity building department, we do a lot of work around diabetes prevention programming. So we will identify organizations that may want to do work in that space to see if they want to partner with us.
Okay.
We will provide them with training in order to get that type of resource available in their organization. But anyone interested in partnering with us and they want to reach out to us can go directly to our website.
Okay, okay, that's helpful. So thank you for that. So you have a really broad scope. Can you talk a little bit about perhaps something the public may not know that Health Promotion Council does that you would like for folks to know?
Yeah, we really offer programs across the lifespan. And
Hmm.
so
Okay.
everyone from someone who may be pregnant, who wants support on how to provide a safe home environment. We have a program called SAFE where we go into homes and support pregnant moms and helping to ensure that their home is set up so that their child, as they're born, can be safe. And we provide them with additional supports and connections to services through that program. But then we also have programs that really support the older adult. And so one of the things that people may not be aware of is that we are able to offer programs across the lifespan. We also have, just based on our affiliation with Public Health Management Corporation, a lot of opportunities to connect people to resources, even if we may not offer that resource directly. And so individuals can contact us. And if we are not able to provide that support, we will have that warm handoff to really connect them with other health and human services.
Okay, so the general public can just reach out and seek services. Are there eligibility requirements for people to be able to reach out to you all for services?
There are, and so those are also listed
Okay.
on our website. Some of our programs are very specific. We have a program called Technology Assistant Children Home Program. This is for families where their child may use some sort of technology to support them. It could be a wheelchair or if they
Mm,
are on a breathing machine. So for that, that's a very specific criteria.
Sure.
where we need to, where we would connect them to that service if it's needed. But then we have others that are extremely broad for our nutrition and active living program, because that is really tied to the supplemental assistance nutrition program. We work with our partners to highlight when a program is being provided. And so we put flyers up in that market. That is really specific to communities where people more people may be SNAP eligible, so who may be
Okay.
on the supplemental assistance nutrition program. And
Mhm.
so for that, you wouldn't necessarily be able to go to our website to sign up. But if you were interested in that resource, we would find out if you are residing in an area where that program is offered and provide you with information on where to go. So we do have some programs where it's specific to the need or to the individual population. And then there's others where it's very broad. Our Focus on Fathers program is open to anyone who is in a father figure. So you could be an uncle, you could be a father, you could be a grandfather. And if you want to provide, if you want to receive support and services to help you to have resources and increase new skills related to parenting, you're able to participate in that program.
Okay, so that's wonderful that people can call, and even if they are not eligible for a particular service, Health Promotion Council will help connect people to where they can find services. So that's really helpful. When people call, they can get some assistance. Can you talk a little bit, just because I'm curious about Focus on Fathers, can you talk a little bit more about the work of Focus on Fathers and what your impact is in that program?
Yeah, so this is a program that we have had for over 20 years. And what we do is we provide support to fathers or father figures who reside in Philadelphia.
Okay.
Um, and it's a 10-week program. We provide case management
Okay.
support
Mhm.
for those fathers. We will also provide them with job skill development and support in connecting to job services. So we have a job navigator. And then we also provide that navigation support. So you get the case management navigation support, you get the fatherhood curriculum. We use a curriculum called 24/7 Dad. And so
Mhm.
we would wrap those participants come to those classes. Some of the classes are in person, sometimes it could be virtual. And then they get also the job navigation support if they need that resource as well.
Okay, that's great. And so it's a 10-week program. That's helpful to hear what the scope of it is, because I wasn't sure when I've seen flyers about it, I wasn't sure if it was a program that was a length of time or if it was an ongoing type of drop-in type of service. So thanks for explaining that in more detail.
Yeah, and with I'll just say one other thing with the Focus on Fathers program is that we also have a very strong alumni group too.
Okay,
So once someone finishes the program and graduates from the program, many of our fathers still stay connected
I love
throughout the years.
I love that. I love that. Okay, so tell us something that perhaps you're looking forward to accomplishing in the coming year.
Oh, so much. We want to continue to ensure that we are meeting the needs of the communities that we serve. And so one of our goals is to always ensure that everything that we do is coming from the community and that we're hearing, we're on the ground working in communities and then innovating based on that. So for instance, our tobacco prevention and control, that's a program where we're ensuring that merchants are following the law and not selling tobacco products to people under the age of 21.
Mhm.
And so we want to continue to innovate that. We just recently were awarded a national award because we created this campaign where we were able to track people who were going into stores who
Mhm.
sell tobacco products to those to individuals, and then provide them with education about youth tobacco sales laws,
Mhm.
about tobacco, where to go if you see someone selling to someone under the age. We were able to track them after they left the store on all of their social media accounts. And they
Oh,
were
wow.
getting targeted ads based on that. So that's a way that we want to continue to innovate, because we learn that that's still an issue, that merchants are still selling tobacco products to those under the age of 21. With our family services department, we want to continue to innovate on our home visiting programs and offer support and really expand that. So we've been working with managed care organizations to expand that footprint so that we can have even more people engaged in our home visiting programs and receive that navigation support. Our parenting services, that we see that there's an increased need for parenting support and services even beyond Philadelphia. And so I mentioned our Focus on Fathers program is specific to Philadelphia. One of the things we're hopeful for is to expand that to other parts of the state. So those are just a few things that I would highlight. We are really excited. We just received a grant to develop a community care hub. This is a grant where you are really trying to connect individuals to address their health-related social needs.
Yes.
And really connect to other organizations. And so we are connecting with 2 organizations in order to really give their constituents connected to other social services and utilizing our Medicare and Medicaid contracts, because we have a Medicare and Medicaid contract. We know that many organizations may not have that, but they can utilize ours to get more people the supports that they need. So that's another thing that we're really excited about rolling out over this next year.
That's wonderful. And congratulations on getting that contract. That's a huge deal moving forward, addressing social determinants of health. So thank you for sharing that. So can you talk a little bit about how someone might be able to volunteer or to donate to Health Promotion Council?
Yeah, so we're always looking for donations. And you can go to our website. Again, it's hpcpa.org. We have on the top of the page, donate now. And so we can donate through PayPal or mailing a check. Our address is on there, 1500 Market Street, Center Square East, which is located on our website as well. So we make it fairly simple. It's just a click of a button and donate now under our PayPal account or by mailing a check.
Okay, great. Thank you so much. And can folks volunteer with any of the programs that you have?
So we oftentimes will do a lot of community events where we are doing tabling events. And so we are always welcome to have people support us in our tabling events alongside with us. And we also have a number of community events. We just had a fatherhood event a couple of weeks ago. And so that's another way where we've had volunteers come in and help us set up some of the games for our families. And so it varies depending on the time of the year. We do have a newsletter that will highlight opportunities to volunteer as well. Our newsletter is on our website. We kind of put everything on our website to make it easy for folks to connect. And so we would love and welcome people to sign up to get our quarterly newsletter as well. And that will have volunteer opportunities listed in the newsletter too.
Okay, that's great. You guys do so much. That is amazing. Thank you for going through it. Really appreciate it. You guys are doing really important work in the community. And I just appreciate you spending time sharing all that information with us today. So thank
you so much for this opportunity.
Thank you. Take care.
You too.